was open. And so, you know, you can't argue with the figures, but they argued with the figures, and they said, you know, this is going to bankrupt us. So a year in, I brought Deloitte in at that time and said, now, here's the PricewaterhouseCoopers report. I want you to take this. We got a year's actual numbers. I want you to look at the actual numbers and make new projections and tell me where we are. Well, they came in and said, well, Governor, I hate to tell you, but PricewaterhouseCoopers was wrong. They said you were going to create 17,000 new jobs over 8 years. You've already created 12,000 new jobs the first year. You're going to create something like 40,000 new jobs over 8 years. They told you that, you know, you were going to see your economy grow by X, and it's really going to grow by Y, a lot more. And so, you know, I did it because it was the right thing to do, but I also, from a political standpoint, felt like if we can keep this in until people actually can experience it, can take advantage of it, I think people's attitudes will change. And look where we are today. People's attitudes have changed.
So if there's ever such thing as a policy and political home run with Medicaid expansion, I'd say you guys got pretty close to both hitting that home run. So clearly, Governor Beshear, your predecessor was excited to just keep going as you were, correct?
Oh, you mean my successor?
Yes, your successor.
Yeah, as you all may know, you know that my successor has filed a waiver to put work requirements and co-pays and all of this into our program, and they say right in the application that over 5 years, about 95,000 Kentuckians will be thrown off the program. And fortunately, a federal judge has twice now looked at that and thrown it back to the department, saying that that's not what a waiver is supposed to be about. It's supposed to be about experimenting to make a system better and not worse. Let me tell you this about John Kasich. This guy said what needed to be said in very few words that I hold up every time I talk about this as an example, the best example of communication that I've ever heard of. He looked at his own party's folks when they were complaining about him expanding Medicaid and basically said, you know, when I arrive at the pearly gates, I don't think St. Peter's going to ask me, what did you do to reduce the size of government? I think he's going to ask me, what did you do for your fellow man and your fellow woman? Our people need this, and we're going to do it. Congratulations.
I don't care about the politics. It means nothing to me. I mean, what the hell do you get elected for if you're there to try to calculate who you're going to make happy? So the decision on Medicaid expansion, people say, you know, it's a really hard decision. It's a piece of cake decision. Am I supposed to say no? You know, no, I'm sorry, you're sleeping under a bridge or you're in jail and that's okay because I got to worry about my politics? Screw the politics. That's a problem with the country today, you know? We do get along. We get along well. I was just in North Carolina pitching Medicaid expansion for Governor Cooper. He's a Democrat. I'm down there, and I'm like, what the hell is going on here? I mean, you're a progressive state. You want to get ahead, and you don't want to, and it's politics. They're worried about primaries. Democrats the same way, Schieffer. The Democrats worried about primaries on the left. So they're way out here. The Republicans primaries on the right. The whole country's out here. And we're tired of it. And it's sort of like Medicare. Why the heck we are not allowing Medicare to negotiate drug prices? It's all politics. I mean, of course we should. At least we negotiate some of it in Medicaid right now. You know, the consumer gets the benefit of the rebates. It's still not enough. You want to give more power to people, and that doesn't. I listened to what Gary said about the pharmaceutical industry, and I agree with part of it. The part of it I don't agree with is, Gary, I'm sure you're watching, a lot of what you said I agree with, but we don't want to destroy them. You know, they got to operate under the philosophy of pigs get fat and hogs get slaughtered, because the most important thing is the rate of development. We just saw about the development of the drug for Alzheimer's. 2 companies spent a lot of money and it came up empty. At the same time, though, we need to have transparency. That's the order of the day. Transparency, transparency, and transparency. In Medicaid and Medicare and the entire healthcare system, value-based, that's how we have to change. More Medicare for all and all that, more government, more price control isn't going to work. Let's let the market work. so that we have a system that rewards excellence and high quality, not duplicative and quantity over quality. So,
well, and this may be a place where John and I disagree a little bit. Because the one area in all of the private sector across this country where I have seen competition not work, it's this area. It's healthcare. And part of it is because this place is owned by the healthcare industry. And this zoo that we call Washington, where you've got all this rank partisanship keeping anybody from even having dinner with each other, but they're all, not all, but a lot, are basically owned by this big conglomeration. And the only way you're going to change that up here, you got to get them to the point where they think they're going to lose if they don't step up and do something. Don't come up here pleading moral righteousness, because we've been doing that for years. That doesn't work. They have to be put in a spot to where they're fearful because their own people back home are so revved up, and that's part of what you're doing here. They've got to be so revved up that these folks are starting to look over their shoulder and say to their healthcare buddies, I'm sorry, but we're going to have to do something. I appreciate the donations, but we're going to have to do something because I'm afraid I'll get beat. And unfortunately, that's the motivation for most of these folks, is to keep where they are. And that's a sad commentary. It does cross the aisle. It's not just one side or the other, but we've got to bring pressure to bear on the electoral process. Look at what happened in 2018. I don't think there was any congressional race that flipped that wasn't over healthcare. That was the issue. And that wasn't lost on a lot of these folks up here. So we just got to really keep building that pressure.
So I agree with that. My only point about competition is we have a market system now that rewards quantity and not quality.
Exactly.
And so what we tried to do in the state, we have done, is that we have provided incentives to primary care doctors to keep people healthy rather than having to get sick. We've opened up the system so that you can compare to some degree what the successive procedures are, what the hospital costs are. Here's one example. We had a list of all the hospitals and what their costs were, and we found out that if you didn't admit every single person who had asthma inside the hospital and you could treat them outpatient, they brought their costs down dramatically. See, I'm a believer that if you go to quality, you pay for a quality-based system, and you open the system up and you have transparency. Really, exactly what Steve is saying is maybe a slightly different way. You will get better care at lower prices. The problem you have with the pharmaceutical industry right now is you don't have the competition. You need to open it up. That's why I think it's reasonable to argue that Medicare should be able to negotiate. Just like Medicaid, we could negotiate to a degree on drug prices, but not as much as we wanted. I wanted to leave some people out of our portfolio if their prices were too high, which would have given us the leverage to bring the prices down. Markets will work if you get them oriented the right way. Today, the healthcare system is oriented towards quantity. How many procedures? Let's just build it on. It's the wrong way to think about healthcare when you get paid for quantity as opposed to quality, openness, transparency. Those. I'm sorry.
So, yeah. So,
and I don't want to be Secretary of HH.
So,
no, I don't want to be.
Sounds like he was asked. So one of the things.
Believe me, I was the last Republican to be asked.
So one of the things that I think we've clearly established is if you're fortunate enough to live in a state that elects the right governor, good things start to happen. But there's still, we have, I think, 17 states that haven't expanded Medicaid, just to take one issue, not fixing that as the only issue. So let's talk about things at the federal level, because if you're unfortunate enough to live a little bit south in Tennessee or a little bit in any one of a number of directions, you might not be so fortunate. So at the federal level, let me start with you, Governor Beshear, with this question. If let's say the Democrats were to have a successful November 2020, they win the White House, and they have 50 votes in the Senate or 51 votes. Would you be a supporter of the Democrats in order to break through these challenges we've talked about today, using the same reconciliation procedure the Democrats criticized Republicans for, to pass some reforms, a single party line vote, or would you say, no, the Democrats ought to commit to taking the time to build a coalition and get to 60 votes and work across the aisle with Republicans?
You know, I think in the real world, you might end up there, but I wouldn't start there. I would say I'm going to try to work across the aisle. As much as it hasn't happened, I think you need to do this. I mean, we got to bring this country together again. And maybe as a last resort, I mean, you can hold that hammer perhaps over the head of the other side to get them to the table. But damn it, let's start acting like Americans instead of Republicans and Democrats. I mean, that's what people really want out in this country. They want politicians, I don't care what political stripe they are, to get together and use some common sense to do these kinds of common sense reforms that we're talking about here today. And let's move the ball down the field.
So let me frame it to you this way, Governor Kasich.
I agree completely, by the way. So anybody's totally right. You know, you got to get the leaders, the people, and they don't have to necessarily be the committee chair people. You need to get the people who are interested in this, the good folks, get them together and try to fix the problem. That's how you do it.
Let me frame it to you this way.
Yeah.
You're up at the pearly gates.
Yeah.
And there's a magic ticket in.
You'll be there someday too.
I'm hoping so. And there's a magic ticket
Although
in.
Gary and Mary may have gone through it. Sorry, Gary.
We'll get right behind that. So, but there's one ticket in. And that ticket in was that in the year 2021, you had to have formed a gang of 10, a gang of 12, a gang of 14 bipartisan leaders who commit that they're going to get a set of bipartisan reforms done. How the hell do you do it? There's a lot at stake for you. What would you do if you needed to say, what issues would you build on, or what politics would you
Well, first of all, I was the chairman of the budget committee where we balanced the budget and then surpluses. You know that actually happened. That is not an Aesop's fable. I worked with Senator Domenici, with the Senate and House leadership, with the Clinton administration, and we actually got the budget balanced. We paid down the largest amount of publicly held debt. Now, you think that that is any harder than, or any easier than healthcare? You just go out and you got your set of principles and you listen to people. It's like Steve and I can work anything. We sit down in a room and design a healthcare plan, at least to get started for the country in a half hour. I mean, it wouldn't be that difficult. I'll give you an example. It would be Medicaid. I would give the states flexibility, but I would also have a safety net. On the Obamacare, on the exchange, I'd give the states some flexibility, but I'd have a safety net. Flexibility is fine. Moving it out of here is fine, but you just can't move it out of here and end up in the Wild Wild West. So there have to be some parameters. And that way you would bring down the cost of Obamacare, more young people would sign up. The same thing on Medicaid, you could reduce your costs. But what you don't want to do is give it to the states and all of a sudden they don't get mental health coverage.
So senators seem to have a little bit more challenging time collaborating than governors do. So how would you?
I don't think that's necessarily true. I don't really believe that because I was involved with John Hickenlooper, in terms of putting an alternative together to what the Republicans wanted to do, and work with Governor Sandoval of New Hampshire. And at that point, it was interesting because people were saying that Hickenlooper, since he was a Democrat and I was a Republican, that we would run as a unity ticket. And I said we couldn't do that because we couldn't fit Hickenlooper and Kasich on a bonus ticket. But nevertheless, there are ways in which we can get started. But ultimately, if you want to solve this healthcare problem, you have got to start rewarding quality and have the market work so that people are working in that business to keep us healthy, not being paid for treating us when we're sick.
Andy, the way you get this started, Kentucky bourbon. I'm telling you, it works. You set people down around the table and everybody has a glass of Kentucky bourbon, and sooner or later you're going to start talking the same too. Well, Kentucky governors drink it all. We don't.
Politics don't matter. He's one of the families out.
I know we're out of time, but I think Steve and I would both agree with this. if you have a leader who says they want to unify and solve this problem, keeping in mind what could happen to your own family, you can make great progress. And you've got to find those leaders who say, for once, we know the system is spiraling out of control, we know it costs too much, we know no matter who you are, you're going to face some sort of rationing. Let's try to have a win-win. And I think you know.
Andy, I know we're out of time, but I want to make one point here. I want you all to work as hard as you can trying to make a difference here in Washington, D.C. But folks, things are happening at the state level. Things are happening, and good things are happening. When you look out at places like New Mexico, where they're looking at a Medicaid buying plan, you know, Maryland is trying to set up a prescription cost affordability board to really tackle drug prices. Lots of great things are going on at the state level, and you don't need to be a part of that. Because I'll tell you, not only will it help some folks, it's a smaller population than the whole country, it'll help folks, but it'll also create even more pressure on this bunch up here to do something. So come out to Middle America and see what's going on.
I know we have to break, but I don't want to miss this point. Though, because I agree with him. And again, it's governors there and they can't shut up. But this is something I'm talking about. Because it was announced today I'm writing another book. And here's what I want to tell you. I agree with him, but I want you to think about Special Olympics. The Special Olympics Cup. Do you know why the Special Olympics Cup was brought back? Is because the public in the country said, we will not tolerate this. The power in America, including in the states, comes from the bottom up. And if we had more people in the country who were willing to stand on the lawn of the State House and push for reasonable and rational gun control, we could get it. You see, at the end, power flows this way, not this way. Civil rights, women's suffrage, environmental awareness, healthcare costs now. See, it comes this way. So when we lose faith in our leaders, we can't lose faith in ourselves because we are in charge of our leaders. And so you get a guy like Steve here. Steve is one of the people, always was as governor. That's why he could act the way he did, because he knew he was a regular folk who pushed things up to the top, even though he was a leader. But remember something, what we do, where we live and who we are and what difference we make, that is where the power is. Not with these big pumas somewhere. It's us. We are the most important people. So, no.
Summarize a couple of points. One is that I said before, if you want to do one thing to make better healthcare reforms, focus on electoral reforms. Make sure that more people vote, it's easier for more people to vote. Make sure that our representative democracy works. And I think what we're hearing from both of them today, is that those are the things that are going to propel, and they need to be propelling the change in their system, because people know what they need, they know what they want to make smart. And the second thing I think is just a really critical lesson is, in Washington, we get fixated on these things called think tanks. These think tanks are the ones that supposedly come up with the big ideas. And these think tanks, and by the way, Republicans have them, the Democrats have them. The Republican, caricature of a think tank